This conference will now be recorded.
Good evening to all. So thank you for giving me an opportunity for presenting few cases before you in this evening, and thank you Dr. Hridya for the nice words. So today with this presentation, it is mainly orienting for a few discussions. Actually, don't consider this as an presentation. It's only a discussion of a few cases and some commonly presenting cases. So I will show more more than this PowerPoint presentation. I would like to share the some cases and the effective management that we can adopt in the day-to-day OPD practice. So when we are talking about day-to-day practice, there are some cases, not the rare presentations, but there are some normally presenting cases. That means that conditions which are usually associated with some systemic diseases like the rheumatoid arthritis, or which is related to some sort of dandruff, or some sort of falling of eyelashes, like that. A lot of cases will come to the general OPD. In that condition, we can easily manage, and there is no need of any further or detailed or some specific investigations, because it can be easily diagnosable with our practice. So first of all, I would like to start the presentation with the refractive errors. So I would like to remember once again that this is, don't consider this as an presentation. So we will go for the discussion after the session. So regarding the refractive errors, I think everyone will be very aware of this type of refractive errors. A lot of etiological factors are responsible for the development and progression of the refractive errors. So while we are considering the Shalakya Tantra, Acharya Susruta clearly mentioned before starting the Nidana, Acharya mentioned that Samkshepataha Kriya Yogo Nidana Parivarjana. So actually the Nidana should be avoided. That means it is very difficult to cure some sort of eye diseases. Rather, it is easy to avoid. So that is, prevention is better than cure. So while the child is presenting with the refractive errors, and the most concern about the refractive error is the increasing power, or it is the progressive type of refractive errors, commonly the progressive myopia. So it is our duty to identify why the power is gradually increasing. So we can take the history, what is the rate of progression of the refractive error. So from the patient's history, we can easily assess the rate of progression, so that the patient usually keeping the prescription along with them, that is spectacle prescription. So assessing the last 3 or 4 prescriptions, we can assess how fast it is progressing. So if it is a progressing with a 6 months progression, that is very much concerned. That means if a child is developing the refractive error at age 6 with -1, then if it is progressing 6 monthly, then at the age of 12, that the power will increase to -6. So that is a very concern. So we have to identify what may be the causes. So we have to think about the defective distant vision that is usually noticed by the class teacher, and the child is coming for the normal visual checkup. So here, as a general physician, we can advise the matters. Means already the patient or the child is having good vision with the glasses. So our duty to restrict the progression. So we have to restrict the child from indoor activities. That means watching the TV, reading the books very close to the eye. So these are the indoor activities, and we have to promote the outdoor activities. So our eyes are designed for the distant vision, and we have to advise the child to go for the outdoor activities more, especially in the evening time. Don't restrict the child in a room. That is a very effective advice for a refractive error. So considering that main theory, we can advise a lot of activities like the eye exercise and occlusion. So this eye exercise is also very effective for managing that condition. So these are the few eye exercises that we can adopt irrespective of the ages and irrespective of the eye strain that may be due to the refractive errors or maybe due to the computer vision or digital strain. Everyone can adopt the eye exercise, that is the sunning, palming, distant near focus, ball exercise, and candle light reading. These are the commonly advising eye exercise. So actually this eye exercise will relax our eyes. So the main problem of the refractive errors are the eye strain. That's the eye strain which is leading to the headache or recurrent sty or watering or photophobia. What may be the complaints? If it is due to the refractive error, we can adopt the following these type of eye exercises. So for the limiting the progression, the eye exercise will hold a main part. According to the condition of the child, we have to advise for the eye exercise. So all this means if you are advising for a distant near focus, then the videos are available in the YouTube. So the patient can see the video and they can adopt in their life, because this type of exercise need a continuous practice, because the progression is according to the age. So we have to insist the child for doing this type of exercise minimum for 6 months and maximum up to 3 to 4 years we have to advise. And the main treatment, actually this type of treatment which can be practiced by a general physician also, because these types of treatment is very easy to practice in young children wait up to the 7 years of age. Actually the tarpana means for controlling the refractive error, tarpana is a very good procedure. But we know that the tarpana need a purva karma, that is a nasya, and nasya can be adopted after the age of 7. So for a full course of treatment, we have to means wait for or wait up to the 7 years of age, and accordingly we can start the treatment. So it usually needs the Vicharana Snehapana, Pradimarshanasya, Anjana, and Netra Pichu. These are the very effective. Actually, if we are going for a treatment plan, then we can advise for a Vicharana Snehavana followed by a Mrudu Virejana and followed by a Pratimarshanasya or Marshanasya, and then go for the Tarpana. This is a course of line means management for a patient having a refractive error, and advise that patient to go for this type of treatment minimum at the gap of 6 months. Tarpana in the gap of 6 months. In a general physician and or in the BAMS holding degree holding person can easily adopt this line of management. So actually we have to explain the condition to the patient and convince the patient what we are going to do and advise. Usually when the patient is presenting in the OPD, then advise or identify what may be the reason, and according to the Acharya's opinion, Nidana Parivarjana, then we have to avoid that condition. It may be if it is a mobile, excessive use of the mobile, then advise the parents to restrict the mobile and to promote the outdoor activities. The outdoor activities, it may be some sort of cycling or maybe some sort of shuttle or badminton, like that we can advise anything which will be entertaining to the student as well as child, and as well as it is very much relaxing to the eyes. This is a common line of management for a case of refractive error. So one thing we have to keep in mind, never say no to power glasses. Means actually most of the patients are coming to the OPD for avoiding the glasses, but if we are advising to avoid the glass, then we have to define why I am advising or why I am advise that child to avoid the glasses. If the glass is avoided, then there may be the severe sort of blurring. So if there is severe sort of blurring, then that is going to create more problem in the eyes. So with the help of the glasses, we have to start the treatment, and then we can reduce the power, and gradually where there are two aim of our treatment. One is to reduce the power of the glasses, and next is to restrict the power, that means to prevent the progression. Like that we have doing here, we are adopting the preventive ophthalmology or preventive eye care, that is prevention of the development or progression of the myopia. Here we have to think about the three factors. First, avoid the nidana. Second, advise the eye exercise. Third, go for the treatment and pathyavatya. That means Kridapanam and Mudgam, then Amalagi, then Shiro Abhyangam, then Pada Abhyangam, and the due course of Tarpana in a gap of 6 months. It is sufficient. And this patching and occlusion, it is a very useful treatment in the case of refractive errors. So if the child is having, from the prescription itself we can identify that the child is having reduced vision in one eye. If one eye is having reduced vision, then advise the child to go for the occlusion of the normal eye. If the normal eye is occluded, then the brain has to use the lazy eye. So it is a very effective line of management of lazy eye, or it is termed as the amblyopia. So we have to advise for the occlusion. So this occlusion can be considered in the group of eye exercise. So advise the patient to go for the eye exercise and occlude the eye, especially for a period of 2 to 6 hours per day. So usually we are advising 4 hours in the evening time, and the child can go for a drawing because the eye normal eye is occluded, so the eye with having use will be reduced vision. So restrict for the near vision activities like drawing or coloring, and never entertain for watching TV or looking for the mobile. So this is also a very good treatment in the management of refractive errors. And this, I think everyone will be aware of this condition. This is a patient is coming with a deposition of whitish material in the lid margin with irritation, watering, and falling of eyelashes. So when we are taking the history, we can see that the condition is usually associated with the dandruff. So this is very common in the day-to-day practice, that it is the blepharitis. Usually it is associated with the scalp seborrheic dermatitis. That is a dandruff. So the dandruff associated eye problem, it is the squamous blepharitis or ulcerative blepharitis. So by examination itself, we can identify it is a squamous type of or ulcerative type. That means if the scales, we are removing the scales, and if the patient is feeling pain, then that will be an ulceration. Means the scales, one it is detached from the lid margin, then it will start pain or burning, then it is ulcerative. So it is very easy to manage that condition. If it is a squamous blepharitis, then we can consider it as a vata kapha predominant condition. And if it is an ulcerative, then vata pitta. That means both conditions, it is developed due to the dryness. So there will be associated the vata, and vata will be associated with the kapha in the condition of squamous blepharitis, and it will be associated with the pitta in the condition of ulcerative blepharitis. And it is very easy to cure. So advise the patient to remove the scales with the cotton buds dipped in the Triphala Kashaya, and advise the patient to remove the scales carefully. And after that, if it is carefully removed, then advise the patient for applying the sneha. Sneha means it is very effective to reduce the dryness. That is, blepharitis is usually associated with the dryness. So remove the scales and advise the sneha. So usually we are advising the Shuddha Eranda Taila. So that is Krimihara property, and it is will be promoting the eyelash growth. So the Eranda Taila application and removal of the scales, if it is in the beginning stage, it is necessary. It is only needed for that condition. And if it is having a severe problem and having the severe association with the dandruff, then we have to treat the dandruff by starting the snehavana, especially tiktaka or mahatiktaka or kugulu tiktaka krida, that we have to start and again go for the virechana, and then again we have to go for the shamana treatment. And in the case of ulcerative blepharitis, the same method, that means remove the scales and apply for the krida, and that krida will be of tiktaka krida. Then we can easily apply the tiktaka krida, and that ulcerations will be easily healed by the application of that Tikta Gharda, or we can use the Mahatiktaka Gharda or Padoladi Gharda in that condition. So both these conditions need the Vata Shamana and Kapha Shamana in squamous and Vata Pitta Shamana in ulcerative. And if the patient is having severe burning sensation, then we can advise for a Kshira Sega. And the Kshira Sega should contain the Manjishta and Laksha. So the Manjishta and Laksha will easily heal the wound, and the scales will be minimum in a case of ulcerative, and it will be maximum in the case of squamous. Like that, we can easily treat that condition. And for a preventive aspect, tell the patient to apply the Murtha Taila, especially with that of Amalatyadi or Durdarapatradi, and regularly apply the Eranda Taila in the eyelash, the root of the eyelashes, for a continuous, for a month of 45 days, for 1.5 months. If that child or that patient is continuing this type of treatment, then we can easily prevent this condition. So this is a very common presentation in the OPD. By just the torchlight itself, we can identify that condition. This is a blepharitis, case of blepharitis, and usually associated with itching, watering, and falling of the eyelashes. So and we can advise the segam and the Koshna Sega. That means it is very useful to remove the scales. That means the Eshti Trifala Kwatha that can be used, and Mahatiktaka Khrda or Durva Khrda and Leba over the eyelashes. And in some cases, we are advising the Netra Pichu. That means soaking the Tikta Khrda in a cotton and spreading over the closed eyelids. That is the Netra Pichu can also be advised. And if needed, then only the internal medicines are advisable. Otherwise, with the local treatment itself, it will subside. And this is a condition. You can see there the then some sort of fatty material which is coming out. That is the mebomitis. That means when the lid margin is having some engorgement with the cheesy material, then it is the mebomitis. This mebomitis is usually associated with the dryness of the eyes. So in dryness of the eyes, we can, if the patient is presenting with a dry eye, irrespective of the reason, we can advise for a eye massage. So the eye massage is helpful. That means it may be the with the help of the eye means that is eye bud, means the buds, or with the help of the Kshiravela and the finger massage, it will be very effective for extracting the secretions from the meibomian gland, which is usually pended up in the glands. So it will be expressed out from the meibomian gland, and this condition is easily curable. So if the patient is presenting with severe sort of itching and dryness, then the meibomitis may be a cause. So if there is a stickiness in the eyelids and then dandruff like material in the eyelashes, then we can easily go for this type of management. And here also the Vata Kapha condition. So this can be, it is a Srodorotha. So we can advise for the sponge bath. That means dipping up the cotton in a Yeshti Trifala Kashaya and applying a lukewarm fermentation over the eyelids, which is also very useful for removing or which reducing this type of condition. And this one is also a very common presentation in the OPD. There is an acute pain with redness, edema at the pus point, and a tender swelling at the lid margin. It is nothing. Easily we can identify it as a stye. Stye means it is the hair root infection. So the furunculosis, that is hair root infection, is the stye. So it should be, it can be, yes, it is considered as a some sort of abscess, and it should be drained. So if it is very pakku avastha, then just remove that eyelash, then it will be easily evacuated, and after that the medicine is required. And if it is in the ama avastha, then the lebana, that is vidalaga, is a very effective treatment. And with the vidalaga only, within 5 days the patient will definitely respond. That means the response of the patient that we can see within 5 days. That means the mukkadi vidalagam, that is mukkadi porambada, along with the kshira or along with the laksha kashaya, that is very effective, and apply over the means eyelids excluding the eyelashes, and keep it there for 45 minutes and remove it. And after that, then go for the Seka with that Lothra Kashaya or the Dharvi Kashaya. That will be very effective. And internal medicine, then we can go for the Kaishwara Gugulu or Trifala Gugulu along with the Panchatiktaka or that Manjishtadi Kashaya. It is only needed. And if the patient is having severe pain, then go for the lukewarm fermentation, and it will be spontaneously ruptured. And if it is spontaneously ruptured, then just squeeze it with the help of that buds, cotton buds, and then go for a Seka. It is only necessary. So if it is the stye is going or coming as a recurrent condition, then only we have to go for a Snehabana and Virechana. And here also we have to think about the dietary habits of the patient, and usually the excessive use of the carbohydrate are the main cause of developing this sort of stay. So if the patient is taking the potato or tapioca for a means large quantity or frequent use, then we have to discourage it. That may be the increased use of carbohydrate is the main cause of developing this type of condition. And the next one will be the diabetes. So we have to check for a diabetic as well as restrict some sort of food in the daily use. That is enough. So this is a case that we have treated in our OPD from this is a picture from the OPD itself. So by looking the eye, we can identify the dosha. No need to go for a detailed diagnosis. So we can see the redness and pain and edema, redness, pain and edema. So this condition can be considered as a shofa, and it can be considered as a ama yukta netra roga. That means udirna vedanam netram raga shofa samanyidam karsha nistoda shula astra yuktam. So in condition, this is the line of management will be of shofa, and that shofa will be which stage then we have to concentrate on. That is amavastha, pachimanavastha or pakvavastha. So if it is the pakvavastha, then go for a prick or remove the eyelashes, then that will be evacuated. And if it is the amavastha or pachimanavastha, then go for the vidalaga. So the mukkadi vidalaga is the one and only medicine which is applicable here along with the kshira, and then we can go for a seka. So this is the condition that is I think that patient is responded within 1 week. The complete condition is cured with only the vidalaga and sega and the internal use of guluchadi kashaya and kaishwara gugulu. So if the inflammatory swelling in the eye with a just an examination only, we can identify the dosha, and if it is having a shofa samprapti, then identify which type of shofa is presenting, ama shofa, pachimana shofa or pakwa shofa. Accordingly, we have to apply the treatment principle. That's enough. And this is another case. Here we can see it is not an inflammatory edema. It is having the same color. That means usually in many contexts, Acharya Gatra Savarna Shofa. That means it is not having a color change. That is the same color as that of skin and having developing with edema. So this is an edema due to the trauma. So that is easily managed with the Nagaradi Leva. So with the Nagaradi Leva also it can be used in some specific conditions, and if the shofa is of, I thought we can identify this shofa as an abhigadaja shofa. So the abhigadaja shofa main or the very important medicine that we can adopt is the Nagaradileba. So here we have to adopt the Nagaradileba, and the medium we can use the Dhanyamla itself. So that is the paste, make a paste of the Nagaradi Leba with the Dhanyamla, and with the lukewarm condition we have to apply over the edema, so it will be subsided. So this is a two type of swelling. The first case that we have discussed is the inflammatory, and here it is a non-inflammatory. Both condition that we have managed with the Vidalaga. And this is another case. Here also you can see the left eye. The first one picture is the before starting the treatment. The patient is having some sort of drooping of the lid in the means initial stage. In that condition, by identifying itself, we can diagnose that it is due to the edema. Here also, the Sega and Vidalaga, that is a both the treatment is very effective to reduce the local swelling. So we can, because this type of presentation is not associated with any sort of blurring of vision, so in the general practice itself we can easily start the treatment. So this is a case actually I have included from our OPD. So this case is having the left eye having some sort of drooping. So at that time only the patient identified that she is having the problem like that, but it is not due to the edema. So if it is due to the edema, then the mechanical, that is a heaviness of that edema will cause the ptosis. But here you can see the position of the eyebrow. So in position of the eyebrow, it is elevated, that is mainly due to the neurological, that is the ptosis. In the conditions like so you can see here there is no elevation of the eyebrows. So if it is due to the mechanical, then the eyebrows will be in the normal position. And nowadays most of the patients are coming into the OPD with the digital strain. So the digital strain means we cannot restrict some group of people from using the digital devices, because it is a part of our life. So only the prevention of the eyes from the damage, from the harmful uh, radiations from the digital device, that is the only one and only treatment approach here. So a lot of, means more than 50% of the adults are having this problem. So usually the symptoms ranging from the eye pain, headache, eye sensitivity, eye twitching, itching, burning, dryness, squinting, blurring of vision, everything will be presenting with this type of digital eye strain. So why this digital eye strain is caused? This is mainly due to the blue light damage. So usually in the market the blue filters are available. So if the patient is satisfied with that, then they don't restrict the patients for using that type of glasses. It is the damage due to the blue light. So the blue light causes damage to the eye. That means the light from the LED used in the smartphones, TVs, and tablets has wavelength between 400 and 490. So this up to 400 nanometer, the light rays, the harmful light rays are absorbed by the cornea and lens. But the blue light having the means wavelength more than that, and it will easily reach the retina, and gradually it will start more problem to the retina, starting from the um, retinal irritations and up to a cause of age related macular degeneration. That is also very much associated with the long term effect of the LEDs from the means mobile smart devices. So here you can see the most of the patients are coming with the reduced sleep. So the retinal irritation will also leads to the sleeplessness. So we have to advise some sort of prevention of eyes from this digital eye strain. So these are few steps, that is means resting the eyes for 15 minutes after 2 hours of continuous computer use. So these are the methods that we have to advise. Not the means actually Susruta mentioned that Nidana Parivarjanam. Here if it is not possible, then we have to live with that device. So advise the patients to minimize the eye strain due to that device. So every 20 minutes of computer looking or viewing, look into a distance of 20 seconds to allow the eyes to chance to refocus. So the focus and refocusing is another problem. So looking distance, and that we have already discussed, concentrating or focusing to the distant objects are very much relaxing to the eyes. So if we want to relax our eyes, the one and only method to look for far infinity. So if the patients are looking for distance after a period of work of continuous work of 20 minutes, then it is relaxing. And The screen filters for glare control that can be used and increase the font size and wearing the glasses. All these are the some sort of methods, and we can advise the 20-20-20 rule. That means after 20 minutes of work for 20 seconds, look a object 20 feet away for 20 seconds. So this is a 20-20-20 rule, and it can be adopted by IT professionals. And another condition is the misdirected cilia, or it is the trichiasis. So it is a common presentation in the OPD in old age. Old age, that is the misdirected cilia that will cause irritation in the cornea. And by torchlight itself, we can identify that cilia. And if that is the problem, then it is easily we can epilate by using the epilation forceps or the eyebrow pluckers. We can use that for the removing the eyelashes. So these are the cases you can you see, that is the trichiasis. It is the rubbing in the cornea. If it is going for a long period, or chronic irritation will cause the corneal injury. Another problem that we are usually encountering is the dry eye. So the dry eye means it is having a vast or a long chronic presentation, as well as a lot of causes will leading to the dry eye, starting from the systemic diseases like the rheumatoid arthritis, and some sort of tuberculosis or long-standing diseases, and some sort of internal medicines, mainly the medicines which is advised in the cardiac medications like cospirine, clopidogrel, and the statin tablets, along with the BP medicines. Everything will cause the dryness of the eyes. So usually the dryness of the eyes can be identified by asking the experience of dryness of the mouth. So usually the patients taking the cardiac medications will tell that they are experiencing the dryness of the mouth, that is the xerostomia during the night time. So we can identify that it is, there will be a definite association with the dryness of the eyes also. So by this we can easily diagnose the dry eye, and on examination there will be lusterless cornea and conjunctiva, and there will be mild congestion, and the patient will be presented with a foreign body sensation, dryness feeling, itching, and ocular discomfort. So usually in the allopathic side, it is the tear supplements. Tear supplements are the one and only treatment which is advisable in the modern science. And if they are starting the tear supplements, then they cannot withdraw that medicine, and it is very costly, and it is having a lot of preservatives that will, chronic use of that will again causes the corneal damage due to the impact of the preservatives. So we can advise our natural Ayurvedic management. So our main line of approach is the Snehana therapy. So how we can attain that Snehana? So the patient having the dry eye, having a lot of excretions, that means there will be reduced tear, and the discharge will be accumulating, and that discharge will cause the stickiness of the lids, and the tear will be very much viscous. So we have to advise for a Sega with the Himakashaya. Himakashaya Sega. That means advise the patient to soak the medicine in 2 glasses of water in the previous night. So the usually using medicines are the Manjishta, Darvi, Yeshti, and Draksha, that we can easily soak in the lukewarm water or the hot water. Just soak it, and in the early morning just filter it and do the Sega. So that Sega will be very much cleaning to the eye, and all the debris and the discharges will be cleaned. And after that, then we have to start the Snehana. Snehana means first we have to identify is that eye is ready to accommodate the Krida. Means if the patient is having severe photophobia, watering, and redness, the Krida application is not at all recommended. In that condition, we have to go for a trial and error method. That means if that eye is ready to accommodate the Krida, then we can start with the Netra Pichu. So that Netra Pichu with Durva Krida or Tikta Krida or Padoladi Krida will tell is that eye is effective to accommodate the Krida. If it is not, then wait. up to the reduction of the watering and photophobia by the internal medicines as well as the SEGA. And after it is subsiding, then start with the netra piju, and if the patient is accommodating that, then start with the krida aschodhana, and after that only needed, then we can go for a tarpana. And along with this krida aschodhana, we can advise for a pradimarshanasya with the krida itself. That means krida means the padoladi krida or jivaniya gana krida or the jivandedi krida also is very effective for the dry eye for local application as in the form of sneha aschodhana and the form of pradimarsha nasya. And next common problem which is encountering in our regular OPD is the foreign body. So try to locate the foreign body. So usually the foreign body can be detected with the torchlight, and if it is not visible in the exposed conjunctiva, that means the conjunctiva, that is conjunctival fornices, the medial canthus, everything, the area is not having the foreign body, then go for the everting the eyelids. So usually the foreign body are means embedded in the sulcus subtarsalis. That means it is a groove just below the upper tarsal plate. That is the sulcus subtarsalis, and usually if there is a hair, that means hairs or some sort of dust particles or the metallic foreign body will be lodged in that condition. So the patient cannot identify, and we can easily identify by everting the eyelids. So we can see these are the pictures from the regular OPD. So if we are searching for the foreign body in the exposed part of the conjunctiva or the fornices, if it is not visible, then the next we have to evert the eyelids. So it will be available in the sulcus subtarsalis. Then we can easily remove that with the help of a cotton bud. And everyone will be aware that if the patient is having pain, then we can go for an installation of xylocaine. So we can keep one bottle xylocaine hydroside. Usually it will cost around 24 to 30 rupees. So we can keep, and if needed, just dip the cotton bud in the xylocaine and we can remove. Then also it will give an local anesthetic effect. So you can easily remove the foreign body. The identification of foreign body is the main fact, and after that we can easily remove. But this is the corneal foreign body. So if it is corneal foreign body, I think it is better to refer for an ophthalmologist. That means in the Shalakya specialist doctors you can refer. That means we have to remove it by the help of the needle only. And this is the condition. I think this need a fluorescence staining. I am not discussing this case. And this is the removal of the foreign body, and we can easily remove the foreign body by, but it need a experience, and we have to remove it only with the needle, tip of the needle. But the conjunctive, that is the conjunctival foreign body, that can easily be removed with the cotton buds itself. And another condition is the chemosis. It is actually, it is not a disease, but it is usually a presentation. That means edematous conjunctiva. It is the chemos conjunctiva. Usually it is associated with allergy. If the patient is very much rubbing the conjunctiva, then it will start bulging out. So this is the conjunctival chemosis. Actually the patient becomes very much afraid and panic, but it is a very safe condition. So here we have to adopt the lukewarm fermentation along with the Koshna Sega. It is sufficient, like repeated lukewarm fermentation. And in some cases, if it is due to the allergy, then we can advise for an avagundhana also. That means avagundhana with nimba patra and haridra, make it a kalka and dip in a dhanyamala, and we can use for a lukewarm fermentation with that help of that pottery, and that is termed as the avagundhana in the general practice. And it is very easy. Just make the paste or make a kalka and make as a small pottery, dip in the lukewarm the dhanyamala and squeeze it and apply. So the lukewarm fermentation with anti-allergic medicines. So if the chemosis is due to the allergy, then we can advise like that. So this is another case. You can easily identify. This is a pterygium. Actually, if it is the patient is wants to reduce the condition or wants to avoid the progression, then we can go for a long-term angina with the Chandrodevarti or with the Trifala That is a very good angina for this type of condition. Actually, and here also you can see it is a case from the OPD, and you can see a small nodule with some sort of congestion in the sclera. So this is a normal condition. It is an episcleritis. So we know that the episcleritis will not cause a very much irritation and blurring of vision. It is only causing some sort of superficial scleral infection. So only with the local sega. Sega is only necessary in that condition. That means you can use the Guluchi Adi Kashaya Churna for the sega. That means Guluchi Padhanaga Rishta Guluchi Patmaga Rishta Dhanaga Rekta Chandanam. Make that means brought that Guluchi Adi Kashaya and make into a Kashaya means the Guluchi Churna should be converted into a Kashaya and go for a lukewarm the sega, and we can advise the internal medicines. That means here the internal medicines means we need a pitta shamana. So Padoladi Krita along with Avipati during the night time and internal use of the Guluchadi Kashaya with the Kaishwara Gugulu. It is only necessary treatment. So here we have to wait minimum for 2 weeks for the complete remission of the condition. So if the patient is not at all presenting with any type of blurring of the vision, then we can easily manage with the local treatment and with the support of some internal medicines. So this is a condition that we have managed in our OPD only with that is simple treatment. That's a SEGA and internal medicines. It is completely subsided. And this is another case here. The condition that you can see the first picture, the child is presenting with an allergic conjunctivitis. It is a common presentation in the current time. That means in the dry, dusty atmosphere, the child is presenting with a very much redness and itching. So you can see the cornea is having a ring-like structure. So it is an infiltration. It is a bulbar VKC. So if the patient or the child is presenting with this type of itching along with this white ring-like material deposited in the limbus, then it is definitely it is a allergic conjunctivitis. Then in the allergic conjunctivitis, we need the anti-allergic treatment systemic management along with the Aschodana. Aschodana means you can easily adopt the Jadi Mughaladi. So the Jadi Mughaladi, Aschodana and Sega, which should be supported with the internal medicine. Actually, this type of treatment will respond easily to the steroids, but if it is recurrence is more, then the steroids are very dangerous. So this is a condition that we have managed in the OPD. Here you can see the child is presented with bilateral conjunctival redness, and this is a case. So this was a case of allergic conjunctivitis, and you can see this is the presentation. You can see the infiltration of the cornea, and this is the after treatment condition. The condition is completely cured within 5 days. So these are the pictures that we can easily manage in the OPD. So this is another case, the same line of management, that is allergy. That means itching, foreign body sensation, and watering along with the redness. Examine the case, pupillary reaction will be normal, and the you can see the congestion. Congestion will be localized. It will not be diffused. A localized congestion will be there, and the localized condition will be there. Then we can manage the condition with the Sega. Sega means if the drugs are not available, then purchase the Guluchadi Kashaya Churna. It will be available. Then convert that Guluchadi Kashaya Churna into a Sega Kashaya and advise the Sega along with the internal medicines. This is a case. It is another one which is presenting at the painless redness in the conjunctiva. So No, I'm sure that everyone will be aware of the condition. It is a subconjunctival hemorrhage. So it is very easy to treat. Means just identify that condition is a dangerous bleeding disorder. That means if we can trace the all boundaries of that bleeding, then it is very safe. It will not create the problem. So this is a case from the OPD. You can see the conjunctiva is red and there is an injury. It is a fall. The injury in just above the eyebrows. So the injury just above the eyebrows will sweep down to the conjunctiva, and you can see there is a black discoloration below the eyelids. It is a raccoon eye. That means it is a subconjunctival hemorrhage, and this will be going to subside within 1 week or maximum 14 days if needed. So our potent treatment, just Sharkara, Mastu, Kshaudram. It is the one and only treatment required for that condition. Sharkara, Mastu and Kshaudram. Take the Mastu, that means the uh, supernatant part of the dahi, filter it out and add the sugar to that, and before instilling to the drop ice, then mix it with honey. So that can be used as a 3 times per day, 4 drops 3 times per day. That means totally Robana Ashodhana is indicated for 12 drops. So these 12 drops will be dividing into 3 times, that is 4 drops for 3 times, minimum for 1 week to 2 weeks will completely resolve that condition. And if needed, patient is having some if usually the patient will be somewhat panic about the redness in the eyes. So if we have, for a support of the mental satisfaction of the patient, we can start the internal medicines, especially the Punarnavadi Kashaya with the Chandraprabha, and some cases we are giving the Padola the Gana Kashaya with the Kaishwara Gugulu. That is necessary for the internal medicines. And if needed, if the patient is having some sort of constipation, then we can go for the Dashamula Haridiki with Avipati. That's enough for managing this type of condition. And this is another case. You can see this is a typical form of cobblestone appearance in the tarsal conjunctiva. It indicates a chronic allergy. So here, I think we can start the internal medicines, but it needs some sort of, we are evert, means don't afraid to evert the eyes, because if a patient is coming with any type of foreign body or itching, then just evert the eyes and observe the tarsal conjunctiva. If the tarsal conjunctiva is having some sort of elevations or some sort of growth, then it will definitely going to irritate the cornea while they are blinking. In that condition, we may need the removal of that masses. So you can see this is also that case having the chronic VKC. And this is another case. You can see the condition which is the lower conjunctiva, patient presented with a localized swelling. So if a patient is presented with a localized swelling, then only we have to identify it is an inflammatory or non-inflammatory. Accordingly, we can start the Vidalaga, Sega and internal medicines. So these are the cases of subconjunctival hemorrhage. So you can see this is a subconjunctival hemorrhage presented with some sort of injury from that grass cutting machine. So you can see the massive hemorrhage. It will go into subside by reducing the size, and the last part will be remaining in the near the cornea, and at last it will also be subsided. So you can see the subconjunctival hemorrhage is absorbing like this manner, means it is reducing the thickness and ultimately it will be absorbed. So this is a case of episcleritis. That means we have already. So this is a case presented with episcleritis, which is presented due to the complication of rheumatoid arthritis. That is a patient having the rheumatoid arthritis. So here we have done the management of the pitta and vada systemic management, and with the support of that systemic management we have done the Vidalaga, Sega and Jaluga for this type of condition. So you can see it is gradually subsiding. So at last it is completely subsided. So this is a case. I think in as a regular OPD observation, I am showing this is a case of corneal neovascularization. It is a asadhya condition, and if the patient is having some sort of irritation due to the conjunctival uh, or the corneal neovascularization, then only the treatment is needed. So this is a picture you can see. This is a normal OPD practice for assessing if the patient is presenting with some sort of severe pain in the eye, and if you are suspecting the glaucoma, this is an easy method to identify the depth of anterior chamber. So just keep the torchlight like that, and you can see there is a shadow which is creating in the nasal side. When the torchlight is shown in the temporal side, there is a shadow creating in the nasal side, and if that shadow is more than half of that temporal iris, exposed iris, then the eye, that angle is the anterior chamber is shallow. That patient may develop glaucoma in during the night time or in the dark exposure to darkness. That means people will dilate, and that may provoke the angle closure glaucoma. And here the next picture you can see, it is a very deep anterior chamber. So the full light is going to the other side without obstructing the, or without casting a eclipse in the nasal side. So it is termed as the eclipse sign, and that is indicates the shallow anterior chamber. So you can compare this picture. This is a shallow anterior chamber, and this is a deep anterior chamber. So it is very common in the OPD. So the patient is having the cataract. So if the patient means pupillary color, you can see it is a grayish white color, and it is definitely a cataract. And if the patient is coming for a preventive aspect, then we can easily start the Kajayapana Anjana for the long term. As actually it is Kajayapana is a Resacria angina, and it is not going to create more irritation to the eyes, and the patient can easily go for the anjana. And it is a daily practice. Anjana is a procedure which is advised in the dinacharya also, so the patient can go for advised to use the Kajayapana anjana for a longer time. So I think it is a common as a common line of management. This table is very useful. That means the medicines which is useful in the Vada Pradhana Netra Roga, Pitta Pradhana Netra Roga, and the Kapha Pradhana Netra Roga, we can identify like that. That means if the patient is having the Vada Pradhana Netra Roga, these are the medicines of choice. That is Erandamula, Devadaru, Shadahua, Saindhava, and Villamula, and the medium will be Krida. So we can go for a Krida Biju, or the medicines which is made into kashaya and add ghruta to that kashaya and go for a sneha sekam. Though, so the kashaya can be made into a sneha by adding the khrida to the kashaya, so that we can go for a sega with khrida. And the pitta shamana group include draksha, chandana, musta, ushira, laksha, ikshu, lodra, Daruharidra, Shaidiba, Utpala, Gairika, Tutta, Sita, and Mastu, and we can go for a Krida Sega or Kshira Sega. So if the patient is having a dry eye, then both the condition that we can use, that is a Krida Sega or a Kshira Sega, we can use. So what should be the treatment of choice? It will be dependent upon the amount of inflammation. So if the amount of inflammation is very high, the patient is presenting with the burning sensation and redness, then Kshira Sega is very much effective. And if the patient is presenting with the foreign body sensation and dryness, then Krida Biju is effective. Like that, we can change the medium. And for managing the kapha condition, Yashti Madhu, Maricha, Pipali, Shigiripatra, Shundi, Shankha, and Madhu. So here in Netraroga having the kapha predominance, most of the medicines are used in the form of Varti Anjana. So the Varti Anjana like the Vimala Varti and the Jadi, Mughaladi Varti, everything having the kapha property, and it will be applying over the conjunctiva. It means, means lid margin with the help of rubbing it in the Madhu. So these are the a line of approach of general diseases. So the patient is presenting with the complaint. From the complaint itself, we can identify which dosha is predominating, and accordingly we can suggest the treatment. So the Triphala, actually Acharya mentioned that Triphala Madhusarpirphyam Nishi Netra Balaja. So for improving the ocular health, so that ocular health can be considered as a preventive aspect of the drishti and as well as the preventive aspect of the allergy. So the ocular surface diseases and the diseases which is manifesting in the visual apparatus, both can be prevented by the use of Triphala. So if the condition is presenting in the visual apparatus like the refractive errors or the pathological myopia, we can go for a Triphala Krita internal with Anupana of Amalagi Kashaya. And if the patient is having a severe sort of allergy, that means just we have discussed the allergic conjunctivitis, then we can advise the use of Triphala in the use of that Triphala Madhu Sarpirphyam Nishi Netra Balayaja. That means mixed with Madhu and Sarpi and used for the promotion of the ocular health. That means improving the local surface defense mechanism or immunity. That is Madhukrita Byakto Rasayananam Sreshtam. If it is combined with Triphala, then it will be using or a target will be on the ocular surface. So adding Triphala to a combination, and we can consider it as a target to make the medicine to reach on the eyes. And the Sega, Aschodhana, Pindi, Vidalaga, and Avagundhana are the very good line of management if the condition is manifesting in the anterior segment. That means in the conjunctiva, cornea, or eyelids. Then we can adopt this line of management. And if it is most commonly presenting in the posterior segment, like the pathological myopia or ARMD like that, then we can go for the Tarpana. Okay, so these are the presentation that I have made, and I will show a few videos. So this is a case that you can see it is a case of non-inflammatory swelling. It is a Legana. So the Legana can be managed with the Ushna Prayoga. That means the Vidalaga with the Ushna Dravya and the Ruksha Sweda. That means making the Avagundhana with the Triphala Churna pottery. Don't mix with the Dravadravya, and we can apply just like the Uddhartana, we can apply the direct heat in the eyelids with the help of Avagundhana Sweda. You can see this is a case. The patient is presented with a foreign body sensation, and you can see there are a lot of concretions. Actually, it can be easily removed with the needles. And, so this is a case. I think you can see this is a case of poor convergence. Is it visible?
Yes, sir.
Yes, sir.
Okay, so when we are assessing if the means the patient is coming with eye strain, if the patient is coming with a lot of eye strain, just go for this test. So just concentrate on a means a tip of a pen and approach towards the nasal. Then you can see the left eye is diverging. So that type of patients will have more convergence problems. So we can see if it is coming, then the left eye is going out. So here the treatment required is the convergence exercise along with the Sneha Sweda application. So this condition is mainly occurring due to the incoordination of the rectus muscle. So the medial rectus is not coordinating with the medial rectus of the other eye. So we have to advise if there is a muscle weakness, then that power of our treatment is the Sneha Sweda. So go for a local application of the Kshirabala Sevanavarti and go for a Mridu Sweda and advise the patient to practice the convergence exercise. So here you can see this is iris shadow test. So for identifying the immature cataract, the pupillary reaction is very good. And here you can see the iris shadow is creating when we are putting the torch in one side, then the shadow of the iris is casted on the lens. So this is an iris shadow test, and this by this test we can identify the cataract. So if it is absent, then it may be normal or it may be the hypermature. So if the iris shadow is present, then the patient will definitely have the vision between 6 by near to 6 by 24. So this is a case of entropy, and you can see the eyelashes are rolled towards the cornea, and if you are just pulling, you can see it is coming out from the eyelashes, means from the cornea. Otherwise it is stuck on the cornea, and that stuck eyelashes is creating more problems to the patient. So in that condition we can advise the eye massage. That means circular massage over the eyelash, means eyelids, and if necessary we can epilate that eyelashes, and it will be suddenly relieve the condition. But as we know, it is a pakshma kopa and it is yapia, and the eyelashes will regrow, and we have to again remove that. And meanwhile we can advise for a that nyavara, that means shashtika lebana. So the shashtika lebana is very effective to strengthen the eyelid muscles. So in that condition, make the shashtika into a pottery and cook it and apply over the weak lower lid muscles and go for a gentle massage. So it will again improve the condition, and usually this condition is a surgical intervention advised in the modern science, and this surgical intervention is going to create more problem, because see, after the surgery the patient is not able to close the lids like that, a lot of complications. So the patient is coming for the Ayurveda, and we can just by strengthening the lids and removing the irritation, that is enough for treating such cases. I think one more case. So this is a case, you can see it is having the patient is presented with a divergent squint. So the squint is always a problem. So if a child is presenting with a squint, and if it is a convergent squint, then it is safe, no problem. And if the patient is presenting with a divergent squint, then it is always dangerous. So if the patient have lost vision, then only that I will present as a divergence. Otherwise the convergent squint is always safe. So this is that condition that just we have discussed, the entropy on the condition, the epilation done, and the patient relieved from the irritation, and after that we have to start for the Pradhamachanasya and Annalebana. So here also this case, this you can see this is also having a poor convergence. And first we have to check whether the eye muscles are working or it is due to paralyzed. Otherwise then go for a test. Then you can see the right eye is going out. So close, I advise the patient to close the eyelids and then again move the pen towards the nose, and you can see the right eye is going out. That means the convergence is very poor. The left eye is converging, but right eye is going out. So this type of condition, usually the patient is presented with a double vision or very much eye strain after looking the mobiles or after reading in the for a short time reading will also going to create more problems. So in that condition, the eye exercise, mainly the convergence exercise, will be very useful. So don't uh, hesitate to go for a convergence test if the patient is presenting with a headache or more difficulty for near vision. So this is also a case having a cataract. By the torchlight itself, we can easily identify the cataract by identifying the iris shadow. So this is an iris shadow test, and if the iris shadow is there with a good pupillary reaction, you can see this pupillary reaction is very good. That is a very good pupillary reaction along with iris shadow that indicate a patient is having a comfortable vision, and we can advise the anjana for managing that condition. So I think it's all about my presentation. So we can move for a discussion. If there any discussion, then we can discuss the case.
Thank you, sir, for such an enlightening and sincere session. Now we can move on to the queries we have. The first doubt is, what is the care that should be taken in the second stage of diabetic retinopathy, and how is its management done?
Actually, the second stage of retinopathy, actually the retinopathy means it is the some sort of problems which is going to be created in the retina due to the diabetes. So usually it is associated with the vascular problem. So the problems starting with the microvascular occlusion. So the Srodhorodha is the first stage. So where is the Srodhorodha is happening? So in the first stage there will be the retinal edema. So it is can be considered as a kapha pradhana condition. So it should be managed with the mukhaleba. The treatment of shofa is the alevaha adi upakramaha esha sarva shofanam samanyaha pradhanatamasya. Just like we have to adopt the lebana as shiroleba, mukhaleba, and netraleba. Netraleba means vidalaka. So if it is in the first stage, then treatment should be concentrating on the shofahara chikitsa. And in the second stage, the edema, the microvascular occlusion will going to create, there will be an infarct will be there. The infected area will be supported by the neovascularization. That means it is a PDR stage, that is proliferative diabetic retinopathy. Here the blood vessels are going to be proliferating. So here the condition is the Pitta Pradhana, Rekta Pitta Pradhana condition. Here the main problem is that there may be a chance of readily bleeding in the retina, and if that bleed occurs due to the vitreous hemorrhage, the patient will lost the vision as a sudden painless loss of vision. So as a preventive aspect, our line of management is the Pradiloma Chikilsa. That means Apana Vayu Anilomana is the line of management. So Pradiloma Chikilsa means then we have to go for a Anilomana type of medicines. Then we can start with the Drakshadi Kashaya or Avibhati Churna, like that. Trivur Churna, everything should be supported with the Adhomarka Shodhana. And in the locally, again, we can go for the Manjishtadi or Guluchadi, Shiroleba and Mukhaleba. And after that, very effective treatment will be the Jalogavacharana. So we can go for a Jalogavacharana, and after that, it is the Chandanadi Anchana. Like that, we have to manage the second stage. So the condition here, the stage-wise approach means the dosha-wise analysis, and again the presence of shofa. So if there is no shofa, then we can start the snehapana. Actually, in the diabetic retinopathy, first and second stages, we are not going for an achapana. Instead, that we can go for a sadhya sneha and go for a virechana. And mainly the lebana, means shiroleba and mukhaleba are the main treatment of choice.
Thank you, sir. So the next question is, How far can conjunctivitis be managed in general OP? What is the difference in approach of bacterial and viral conjunctivitis?
Actually, it is very easy to manage the conjunctivitis in general OP. Usually, the patients will not go for a consultation if he is aware about the that he is having conjunctivitis. So the patient will wait in the home itself and will be isolated himself. So if that patient is coming to our OPD, means just for an advice. So there will be three types of conjunctivitis, that is bacterial, viral, fungal, and allergic. So mainly the presenting conjunctivitis are of bacterial and viral conjunctivitis. We can easily identify. That means if the patient is presenting with a thick sticky discharge, profuse discharge in the early morning, then that indicates bacterial conjunctivitis. And viral conjunctivitis means it is an angry looking eye. That means the congestion will be maximum, photophobia, pain, and watering will be maximum in viral conjunctivitis. Whereas in bacterial conjunctivitis, the redness will be minimum, and that sticky discharge, that is pus discharge, will be maximum in the bacterial conjunctivitis. So the both conditions we are starting means Sarvesham Akshiroganam Ado Aschodhanam Hidam. So the Sega and Aschodhana along with the Vidalaga are the treatment of choice in this condition. So we have to advise the patient for Sega. So Sega usually we are advising the Triphala. In the case of bacterial conjunctivitis, we have to clean the area so that some sort of Rukshana is needed. So we have to advise the patient to go for the Triphala Kashaya Sega and followed by the Ashodhana. Ashodhana, in the irrespective of the cases, we are advising the Chandana, the Ashodhana. Whereas in viral conjunctivitis, if the photophobia is maximum and redness is maximum and discharge is minimum, then we can advise the Kshiraseka. Kshiraseka is very much effective to reduce the pain, redness, and the photophobia. And again, we have to start with the Chandanadi Aschodhana. Here, the eye is presenting with an ama yukta netra roga. That means udarna vedanam netram raga shofa samannidam karsha nistoda shula asri yuktam. In that condition, it is samaja condition, and in ama yukta netra roga, anjana is contraindicated. So Adhanchana Shuddha Tanur Netra Matrasriye Male Pakkulingi. If it is not Pakwa, don't advise the Anjana. Instead of that Anjana, we can convert that medicine into an Ashodhana form and we can advise the Ashodhana. So local treatment it is necessary. This is only needed, and the systematically and the systemic management may need some in viral conjunctivitis. We have to go for some Murdu Virejana, and in bacterial conjunctivitis we are advising the Padoladi Kashaya along with the Trifalagugulu or Kaisharagulu is the treatment of choice. But the dangerous one is the viral conjunctivitis. So if the patient is having severe photophobia and redness, that means in viral conjunctivitis, due to the anatomical peculiarity, the conjunctivitis will spreading to the cornea also. So usually the viral conjunctivitis, instead of that, we are telling it is viral keratoconjunctivitis. Some part of the superficial cornea will be included in the infection. So if there is some sort of white patches in the cornea, then definitely we have to refer to an ophthalmologist for further management. Otherwise, we can easily just inspect the cornea if it is clear and the patient is not having any other complications like the pustules. That means the viral conjunctivitis may be an after effect of the herpes zoster. So if like that there is no associated features, then we can easily manage the condition in the OPD.
Thank you, sir. So the next doubt is, which Arka preparation is good for dry eyes?
Actually, in dry eye, Arka preparation is not good because the Arka, as we are making the Arka, it is some sort of distillate. As we are thinking in Ayurvedic perspective, it is the Agneya Guna Pradhana medicine. But if it is due to a dry eye, then we can see it is a Vata Pitta Pradhana condition, means it is a severe dry eye, means it will be a local corneal inflammation along with the dryness. In that condition, Arka is not good. And if in some cases, the Lothra and the ST prepared arca is giving us a sort of soothing to the eye or some sort of satisfaction for the patient. But the actual treatment that we have discussed, it is the krida or kshira. So the kshira sega or krida piju should be supported with the arca if necessary only. So, and you can see some cases if we are giving the arca, then the patient will have some irritation, that is max irritation will be increased. So if the irritation is increased, then think that it is a pitta associated condition, and if the patient is easily appreciating the arca, then it is definitely it is a having devoid of the pitta involvement in the samprapti, and it is will be a pure vadika condition. So the dryness can happen as a pure vadika condition as a beginning or early stage, just like the crystalline mila, and after that if the dryness is maximum, then that is going to create the vitiation of the pitta also. In that condition, arca is not good. In that condition, kshira seka or krita biju is the very useful treatment.
Thank you, sir. So the next doubt is how to distinguish between ama and pakvavastha of eyes.
Actually, for only by assessing the presentation, that means I have discussed udirna vedana. That means the patient having the severe pain. Raga, Shofa Samanidam, that means severe redness and edema. Karsham, foreign body sensation. Shula, that means pricking pain. Asriyuktam, then severe watering. So if the patient is presenting with this condition, according to our Ayurvedic principle, it is an Ama Yukta Netra Roga. That means it can be presenting in the allergic conjunctivitis or maybe in the dry eye also, in some sort of Vata Pitta Pradhana. It's in moderate involvement of the cornea will be there, then the patient will present the same condition. Even though the dry eye is a dry eye, the patient can present with the ama yukta netra roga lakshana. In that condition, the krida is not useful, and so we have discussed in the it was discussed earlier that in all sort of dry eye, the tarpana is not good. The eye should be in a position to accommodate the krida. For that, as a trial and error method, we can advise the krida biju. And if the patient is accommodating that krida biju or appreciating that krida biju, then we can say that the eye is ready to accommodate the sneha, and then we can go for the krida or tarpana or krita continuously. Otherwise, it should be considered as an amayukta netraroga. So the amayukta netraroga will be assessed with the clinical presentation. That means if the amayukta netraroga is confirmed, then sega, aschodana, pindi and vidalaga is the only treatment. Tarpana, anchana and pudabaga is strictly contraindicated in that condition.
Thank you, sir. So the next query is it safe to use Anjana in cataract patient with intraocular lens implantation?
Actually, the cataract means it is opacification of the lens. If there is no lens, then no need. No need of using the anjana in cataract. It means we cannot say that in an operated patient having in the intraocular lens, we cannot say that the patient is having cataract, because the cataract is defined as the opacification of the crystalline lens. If the lens is not there, then there is no question of cataract. And for another some other purposes like the conjunctival itching or some sort of allergic nature in the conjunctiva, then we can go for the Ilanir Kolamba as Anjanam for as a sake of action in the conjunctiva only, not in the lens.
Thank you, sir. So the last question is how to oppose cataract?
How to?
So cataract treatment is the query.
Okay. So how to oppose? Actually, the cataract, we can say that the cataract in Ayurveda, it is also considered as a Swabhavika Vyadhi. Swabhavika Vyadhi means Jara, Mrityu, Pipasadaya. All these are happening as a natural. Just like that, the cataract will also happen as a natural way. That means age is the first risk factor of the cataract. So we cannot prevent the aging. So we cannot prevent the cataract starting of the cataract. But the starting of the cataract will never going to create the opacification. So the first stage of cataract is the intumescent stage. So intumescent stage means just hydration of the lens. The hydration of the lens means the aqueous humor is going to enter into the lens. Aqueous humor is having water. So water is not going to create opacity. So if we are able to prevent that or restrict that condition in the hydration stage of the lens only, then that is not going to create visual problems. So our aim of cataract prevention is the netra samrakshana, or the preventive care of the preventable blindness. That is preventive care for protecting the eyes from the preventable blindness. So cataract is a preventable blindness. So we can advise, first we have to reduce or we have to restrict the kapha samprapti in the lens. That means the white opacification is definitely due to the kapha. Acharya mentioned that chakshus tejomayam tasya visheshal sleshmato bhayam. So we have to restrict the kapha accumulation in the urdhva jatru. So urdhva jatru vigareshu visheshal nasya mishyate. So the nasya is the first and foremost medicine that we have to advise for the prevention of the cataract. And pradimarsanasya is ajanma maranam shastam pradimarsham. So we can advise in all ages and in all season we can advise just with anudaila. So tell the patient to start the anjana in the age of 45 or 50 as a sake of prevention of the cataract. This is very useful in the patients having diabetes, because the diabetes patients is going to have the cataract in a speedy manner, because in diabetes it is starting with a kapha pradhana vyadhi. So if a kapha pradhana vyadhi, then kaphaja netra roga, that is a cataract start or cataract development will be very faster. So in that condition, the risk factor more than the age, there will be an additional risk factor, that is a hyperglycemia. So in that condition, Pradimarsanasya in all ages, Pradimarsanasya is the one and best treatment which should be started in the early stage and should be started with the Anjana. So the Pradimarsanasya and Anjana are the medicines which is advised for the daily practice, that is Dinacharya. So Chakshus Tejomay Tasya Vishesha Sleshmadobhayam, it is indicated for the purpose of Anjana Karma. So we can advise the Anjana Karma. If the patient is having a prevention of cataract, no need to go for the daily Anjana. We can insist the patient to do the Anjana twice in a week. That is sufficient. We can use the Kajayavan Anjana or Nivalavarti or the Shanmakshikavarti for the purpose of Anjana daily, twice in a week. And the internal use of Triphala. Here the internal use of Triphala is the Chakshushya Triphala. That means Ega Haridaki Yojya Taucha Yojo Vibhitago, Chatwari Chamalaga Nyesham, Triphalesham Pragartita. That means 4 times of Amalaki. So the Amalaki is having a very rich quantity of vitamin C and antioxidants. So actually the cataract is occurring due to the oxidative damage of the lens fibers. That is, oxidative damage means if we are treating, if we are able to provide antioxidants, then the cataract can be prevented. So the Amalagi is having a very good antioxidant property. So the Pradimarsanasya, Anjana and internal use of Triphala, that is Chakshusha Triphala, is a main and effective management for the prevention of cataract.
Thank you, sir. Sir, we have 3 more doubts. Can we continue?
Yes, definitely.
Okay, sir. So the next doubt is, can we completely cure dry eye through Ayurveda management? Can we completely cure dry eye?
Yes, actually the dry eye, if it is not due to the systemic complication, we can manage. So if it is due to the systemic manifestation like rheumatoid arthritis or due to some autoimmune disease, then actually according to the Ayurvedic principle, pradhana shamane tesham shamano bhavati. Actually, it should be managed. When the pradhana vyadhi is subsided, then the upadrava will also be subsided. And if we are trying to manage the upadrava vyadhi only, the samprapti vigatana will not happen. So if the dry eye is due to the local reason, then we can completely cure that condition. Otherwise, that need a systemic approach. So the combined treatment with Kaya Chikitsa needed for a complete cure of a systemic complication and the dry eye due to the systemic diseases. In that condition, if the systemic disease is not at all curable, then we cannot promise that patient. For example, a long-standing rheumatoid arthritis having that joint deformity and chronic presentation of the RA, then the RA is not at all treatable. Then how we can promise the patient that dry eye is treatable? No, it is not treatable. Actually, if it is due to the local samprapti and the samprapti restricted in the eye only, then it is completely treatable.
Thank you, sir. So the next query is, can you please explain the procedure Pindi?
Actually, Pindi, that Pindi means Pindi Kabalika Prokta Badhade Vastra Pataki. Actually, just bandaging, just like we can say bandaging with a medicinal bandage with a bolus. Actually, we are using the Trifala Pindi, Dhatri Pindi, and Nimba Patra Pindi. Like that, a lot of Pindi can be used according to the condition. So the Pindi is most useful when there is an Amayukta Netra, like the lead edema or allergic conjunctivitis. In that condition, we can use the Pindi. For the Pindi, we need a Kalka. So how we can prepare that kalka? That kalka can be prepared from the churna or as a fresh drug. Means just like the kalka kalpana, that means you have studied the churna and the kalka. The difference between churna and the kalka, that means churna, apluda, dreva, pluda. So by making the churna to the convert that into a kalka form. So what should be added? The churna can be decided by the condition of the patient. So we can use the Eranda Moola Pindi. That means Eranda Moola will be crushed and made into a churna, and we can add kshira and we can make a pindi in the cases of dry eye. And in some cases, if the patient is having severe allergy, then we can use for the Dhatri, Haridra, and Nimba Patra Pindi. Just make it as a fresh. All these are the fresh drugs. So make the kalka without adding any liquid. We can make the kalka and we can apply as a pindi. So we need a kalka for applying the pindi. So make the kalka into a bolus form and keep it between two fold or three folded fold gauze piece and make into a bolus, and that bolus should be kept over the closed eyelids and do the bandaging in that eye. So that bandaging will going to squeeze the medicines to the eyelids, and that medicine, due to the effect of that medicine, that means the medicines are retained. That is, the fresh medicines in the form of kalka is retained in that condition, and that will going to affect the local inflammation very effectively. So this type of pindi, that making the bolus of the medicine with suitable medicines, making into a kalka and made into a bolus form, and keeping over the closed eyelids and just close the eyes. Means just wrap it with the China Banda, then that is the Pindi procedure.
Thank you, sir. So the next query is, how to manage blepharospasm?
Actually, the blepharospasm means that may be two types. That means essential and reflex. So if it is due to the reflex, then if the patient is having some sort of corneal injury, then the patient will have definitely the blepharospasm. Then we have to treat that condition. Otherwise, without any cause, there may be some blepharospasm. So in blepharospasm, in Ayurveda, Bhava Prakasha mentioned that is a disease called Kunjanam. That means Kunjana means Vadadya Vatma Sankocham Pargurvyanti Yadamala Tada Drashtum na Shaknodi Kunjana Nama Tadvida. That means the patient is not able to open the eyes due to the severe spasm. That means the severe spasm means it is having a purely Vataja condition. So here the main line of approach is just the line of approach of the Ardhita Chikitsa we can adopt. Ardhite Navana, Murthni Thailam, Srotrakshi Tarpanam. Just like the same line of management that we can adopt here. And the Snehana, Murtha Thaila and Nasya is very essential. The Nasya means the just like the Ardhita Chikitsa, the Kshira Dhuma Nasya. That means Eranda Patra Mula, Kshira Dhuma along with Nasya. The Nasya should be done with the Kshirapala or Dhanantara, Nasya, Marshanasya, and after that we have to go for the Annalebana. Annalebana is very effective. That means Annalebana or the that is means the Shashtika Pindi. Shashtika Pindi or Shashtika Lebana is very effective, and after that we can go for the Tarpana also.
Thank you, sir. So the next query is, can you please explain the condition in which we can give Tari procedure?
Tari procedure, it is a very useful procedure which is adopting in Kerala practice. That means Tari means it is a form of modification of the Pindi and Vidalaka. In Vidalaka, we are directly applying the medicine over the closed eyes and directly over the eyes, means lid skin. Here in Tari means we have to apply the medicines will be spreaded over a cotton, and that cotton will be applying over the closed eyes. So that is a Tari procedure. That means the Navanita can be used as a Tari. Means Tari having the three procedures. That means Vidalaga, Pindi, and Netra Piju. All these three are combined to make the procedure Tari. Tari means any medicines. That means the Manjishtadi Tari or the Nimba Patra, Haridra Tari, everything, or the Navanita Tari, everything that we can use. That is the procedure is the spreading the medicine with a required or sufficient quantity in a gauze piece and applying that gauze piece in the closed eyes. This is the procedure of Tari.
Thank you, sir. Now we are coming to the last two questions. Any management for corneal opacity? Also, to what extent can Ajaga be managed?
Actually, corneal opacity is very good clinical condition that can be managed through Ayurveda. But Acharya Susruta clearly mentioned that all these type having some prognostic features. So if the corneal opacity in the center part of the cornea and it is having in the deep thick, then Acharya itself mentioned that it is having some sort of asadi lakshana. So it is very difficult. So if it is a superficial corneal opacity, that is a nebula and macula, then it is very easy to treat, and just by doing the lekhananchana. That means mudganchana is a very effective treatment for managing that condition, or we can advise for a Chandrodevarti Anjana. But as we know, the Lekhana procedure is the essential treatment. But the eyes cannot tolerate the Lekhanachana for a longer time. So, Acharya giving an treatment line. That means Nityam cha Shukleshu Sridam Yadaswam Pane cha Nasye cha Kridam Vidadhyat. Means we have to give the Pana, that is Sneha Pana, and Sneha, that means Krida Nasya in between, and again go for the Lekhana procedure. So the Lekhana is the main treatment for the management of the corneal opacity, and if it is curable only if it is having the superficial type of opacity, and the deeper line of opacity we cannot completely manage that condition. And the Ajaga means it is mentioned as an asadhya condition in our Shastra. No need to treat that condition. We can manage if there is some sort of complication. That means if the patient is having severe pain or severe watering or severe headache, then only we can manage. There is no point of treating that condition for retaining the vision. That condition is the Ajaka, means it is an anterior staphylomatous condition. It is usually occurring due to the total inflammation of the eyeball, and the eye is lost. That lost eye should be removed according to the modern. That means evisceration and enucleation is the line of approach. If that destroyed eye is going to create more problem like a pain, that means eye is not able to eye is blind and it is going to create pain, then the one and only treatment advised in modern is the removal of eyeball. So in that condition we can manage with the jalokavacharanam and virejanam and with some sort of siravedhanam. That means ajaga is a rektaja vyadhi and rektaja asadhya vyadhi. So it is having a predominant rekta dhatu. So siramoksha, jalokavacharana, virechana with the trivut krida and with the lebana, we can manage the pain and redness and photophobia, but we cannot retain the vision.
Thank you so much, sir. We have one last question. What is the management of Vadaja Adhimanta?
Vadaja Adhimantha. Vadaja Adhimantha means actually if we have to correlate. That means actually the main problem of the Ayurveda is if we are diagnosing it as an Vadaja Adhimantha, then Adhimantha Lakshana will not be there as a complete manifestation of the Adhimantha will not be there. So it is better to write what is exact diagnosis in modern point of view. So in Vataja Adhimantha, actually the Adhimantha and the Abhishanta are the Vedana Sadhya Vyadhi. So there is no doubt that we have to go for the Siravedha. And means it is a Vadaja condition, but it is having severe painful condition. So the Rekta Mokshana should be done with the utmost care. And the normal treatment of the Adhimantha is the Vada Adhimantha is the Agni Karma. If there is a severe pain, then we can easily go for the Agni Karma with the Shalaka, that means the copper ball cautery above the eyebrows. It is a very good treatment for manage the pain. And as a systemic management, then we have to go for the Snehabana and Nasya. Nasya means we have to start with the Rukshanasya and end up with the Snehanasya. And another effective treatment is the Vasti. So if it is Vadika condition and Adhimanta condition, then we can go for an Eranta Muladi, Matravasti or Eranta Muladi, Yogavasti. Yogavasti will be more effective. Yogavasti is a very good line of management, and along with the local treatments like the Anjana. Anjana means we can do the Pashupada Anjana. The Anjana will be more effective locally and Vasti will be more effective systemically, and as a sort of the pain relief we can adopt the Jaloka as well as Agni Karma.
Thank you so much, sir, for your sincere efforts for today's session. We are coming to the end of the session. I now call upon Jasmine.
Okay, thank you.
Good evening to one and all present here. It is such an honor for me to have the opportunity to thank you all the delegates on behalf of HSA 2021 to 22. I would like to express my gratitude to all the esteemed delegates for their presence and contribution to make this webinar a great success. I extend my gratitude to our Honorable Resource Person, Dr. Sreekumar Sir, Associate Professor, Department of Shalakya Tantra, Government Ayurveda College, TVM, for taking out time from his busy schedule to grace the event. Thank you for inspiring and encouraging us with your extensive knowledge, sir. A special thanks to Dr. J. G., Principal, Government Ayurveda College, TVM, for providing immense support to make this webinar happen. I must thank this organizing team of VEEKSHA Academic Series for their sincere effort in conducting this series. Also, I sincerely thank all the attendees of the meeting for their active participation once again. Thank you.
Thanking everyone once again. Do tune into our Instagram and Facebook pages for updates on upcoming classes. Thank you and good night.
Good night.